Are you writing the NCLEX exam and confused about respiratory alkalosis and respiratory acidosis? You need to watch this video. So for respiratory alkalosis, the memory trick you have to remember is L. So L comes in alkalosis, and L stands for low carbonic acid. That means low carbon dioxide. This results from the patient is in anxiety, or patient is going through asthma, and patient is breathing too fast. That means he's having hyperventilation. His respiratory center is in distress and the respiratory rate is too fast, and hence he's exhaling too much of carbon dioxide from his lungs, and ultimately resulting in low carbonic acid or low CO2. That means it's making lungs do a lot of work. Therefore, the sign and symptom that comes is headache. If the person is having hyperventilation, he's breathing way too fast. That means he's having headache, he's confused, and his blood pressure is going to go low as a compensatory mechanism. If his lungs are working way too hard, he's going to have epigastric pain, and this is going to be a significant sign. Hyperreflexia, that means tetany, involuntary movements. Therefore, the interventions depend on the sign and symptoms. We are going to teach him breathing techniques. In breathing techniques, we will try to teach the patient to voluntarily hold his breath, so that if he holds his breath, he can retain CO2 in his body. And therefore, we can also use a rebreather mask, which helps him to retain carbon dioxide in his lungs and not outside of his lungs. And for tetany, we will give calcium gluconate. Respiratory acidosis, the memory trick you have to remember is C. So C comes in acidosis, and C stands for carbonic acid. So therefore, from hypoventilation, the patient is having a calming effect and retaining too much of carbon dioxide and exhaling a lot of O2. Therefore, the patient is in hypoxia. So the sign and symptoms will be if the lot of CO2, and hence the patient is going through confusion, and one significant feature, coma. So always acidosis is related with coma. Again, remember the memory trick C. The BP falls, and one another significant feature is there is going to be no GI symptoms, but there is going to be seizures. So in coma, the patient is going to have a lot of seizures. So for intervention, if the O2 of the patient is low, you will administer him oxygen, and you will give him semi-Fowler's position because the patient is going through hypoventilation. Last one is suctioning. Bye now.